because real research requires a lot of funding to do. So what we're trying to do is to really equip you in a way that you can be competitive in competing for those research funding that is available out there. So today I'm going to focus on something that is one of the very important part of this, which is beginning and thinking about your research question. I usually say it is the second or the third one. It's not the first thing to think about. The first thing to think about is what research area are you interested in? Because as you go into those areas and you're deciding on those areas of focus, because like me and many of you that are here, we are not bucketed into one bucket. We are into different things that we do. We do HIV, we do mother and child TB, we do uh, non-communicable diseases. So there's so many different things that you do. So for each project, you want to be able to say, what is this area that I'm focusing on, and how do I develop an interesting research question from that area? So that's what we're going to focus today. So I'm going to share my slide, and thank you, Professor Nyaka, for the introduction. And then let me know when you can see my slides. Do I have to do anything to share the slide?
No, just go ahead and share.
Okay, I'm trying to find where to do that. So give me 1 second. Okay, I can see that.
Yeah. Yes.
Okay, can you see my slide?
Yes. So we're waiting for you to pull it. Yes, on slideshow. Yes.
Okay.
Perfect.
Okay, so please let me know if you can see it very well.
Yeah.
And so I'm going to focus like Professor Neka mentioned, and I just want to start with, first of all, giving a very high gratitude to Professor Neka for the slide set. Most of you know I don't usually use slides, but she reminds me that not everybody thinks the way I think, and there are people who are more visual. And she spent time with me to actually put some of these ideas, a lot of them, into slide. Without her, there won't be no slide. I would just talk. But I think what she's done is really make this art. So all the art, all the things you see on the slides, that's her doing. And I'm very grateful for that. So thank you, Sonia. So the art and science of asking the right request question, because if you do ask the such questions, you're going to do the right thing. And that's, we're going to go over this next 45 minutes to really spend time on how that you come about that. I lead the Nigerian Implementation Science Alliance, and again, this is the umbrella which we bring you a lot of what we do over the years. Thank you. So the objective that we're going to try to cover is really to understand what makes a strong research question, to identify and avoid common pitfalls that you see, to gain insight into the funder expectations, to learn strategies for impactful answerable questions, and more importantly, the last part of it is my usual thing. So I'm going to try to get past this slide so that we can go to the last part, which is the Q&A. So as I go around, please put in your question in the Q&A. One of the major things that I always see people don't get grants is that they never follow instructions. So we try to make you do that here because it's one of the problems we see. So follow the instruction. Don't put your questions on chat because we are not going to respond to them. There is no need to put it there. So put them on the Q&A, and we are going to follow the order on which they come in the Q&A as we move forward. So what is a research question? So people have different way of trying to say this, what is a research question, but it is really what you are trying to focus, because you are not going to be able to solve the problem of the world. So you are very narrow. You are a small part of the problem solving team. So there's so many different aspects of a problem. So you want to be able to say, where am I focusing on this problem? So the research question is really the sentence that you refer to when you need to remember what is it and why are you conducting your research. It encapsulates what drives you and something your field need an answer to. If you recognize there are two parts to that second thing, what drives you is very important. Something your field needs an answer to is very important. Two of them have to be there. If it's something that drives you, but people have answered it before, then there is really no research question. If it's what your field requires an answer to, but it doesn't drive you, you are really not going to do very well in trying to work in that area. So I always say these two things, they have to excite you to answer those research questions. And it's a research question that needs to be answered. So this is some of the things we try to put a little bit here that makes you drive that. You see, in terms of the reference here, that critical appraisal of published research papers. That's looking at this in 2017, and they're looking at that 50% of the reviewed clinical studies that they looked at, they failed to clearly define their research question using the established frameworks. And we're going to talk about PICO, which is the common one we use when we are doing clinical research that involves human. You look again on the on Michael from the 2020 again, understanding formulation of research question in postgraduate education. And what they are saying again, that 37% of postgraduate theses had a well-formed research questions that is aligned. So if you look at it, you're saying that 63% of them do not. And the top reason, over years, I have reviewed grants for many different organizations. And one of the things I find out that is the reason that drives the poor skill is the poor scores that people get is lack of a clear hypothesis or research question. By the time you read a specific end or concept note, and at the end of it, you don't understand what the investigator is trying to, the question that he's trying to answer, and you don't understand the hypothesis that he's putting forward, that grant will not score well. It doesn't matter how many pages. It doesn't matter who is writing it. It doesn't matter. That's why I don't get out the grant I write all the time. It's not because I'm not a good candidate for it. It's not because we don't have a good team. My team will tell you that we get one exceptional in this area about the investigators, about the research environment. The one place that we don't get, and if we don't get it, that's what determines. And anytime we score well on it, we get the funding. It's about our research question. That is critical because that's what tells the investigator to keep reading. If he finishes reading that first page and he still doesn't understand it, it's downhill from there. So think about it. You think about why the research question matters. It is, if it's an unfocused research question, a weak research question, it lacks clarity, it lacks direction, leading to a scattered and unfocused research process. And you're going to see that a lot of times people start talking about things they can't even deal with. So, and we're going to go to talk about them when we move forward here. So you look at irrelevant findings. So if you start with a very poor and unfocused research question, you're going to end up not doing what you thought initially you were set out to do. You actually find out that what you're answering is not the actual issue that you thought you were being investigated. And we're going to see how that works. It takes a lot of work to put together a research proposal. Most of you know that if you're doing NIH work, even though the science might be 12 pages, you end up the smallest NIH grant for R03 is almost 150, 180 pages of application. So when you spend the time there to, not a clear research question, what is going to end up is that time, money, resources are wasted. And that is not something that you want to be able to do. You end up with an unreliable result. A weak research question will affect the reliability of the findings that you do. And then when you end up your conclusion, people say, really? He didn't answer the question. And once that is the conclusion of things, again, it leads to a limited impact. Remember the same thing I'm talking about, that when the reviewer is reading the first part of the concept note or specific aim, and after reading that, he's not clear about your research question, is downhill from there. Think about it when you publish. By the time the readers read the abstract, and at the end of the abstract, they are not able to figure out the question you asked and the conclusion you arrived at, or that they don't gel, it is downhill from there. Most times that paper is not read incomplete. So to have impact in both places, you want to be able to make sure that your questions are very, very clear. So those are the characteristics that you need. You want them to be clear. You want them to be focused. You want them to be answerable. So I haven't seen sometimes people say, answer questions that they cannot answer. You want them to be reliable. You want them to be feasible. I always say, if you are saying, oh, the challenges here is poverty. I say poverty was there in the Bible. It was there during the time of the studying. It is there. It will always be there unless you have so much money, and the richest man in the world, although they can give $1 million to people, they can't solve the world poverty problem. The reason, because there are so many people to give $1 million. Giving it to two people aren't going to solve the world problem. So you can't solve poverty. What you can solve is the specific area in the focus. What poverty is poverty leading to poor knowledge. Then you are trying to say, okay, how can we solve this poor knowledge? Since we can't solve poverty, but the problem we're having here is poor knowledge, not the poverty. It's because poverty leads to, because how you define poor is not how people define poor. So you want to be able to say, what is the question that you are trying to answer here? So leave those big things in terms of poverty, in terms of big stuff, come down to very specific. Research are usually specific. They are not random. There are very different frameworks that helps you to be able to look at those ones. The one that I'm going to spend a little bit time, the other ones are here for qualitative methods, for qualitative topics, for both different types of. But what I'm going to focus today, because of time, is the PICOT. It's usually the one that we use for clinical research questions. So this is something that you want to be able to do. Most of you will know it as PICOT. The T is there is an optional part of it, but you will remember this, that you're talking about the patient and the population, which is the P. You have to be able to define that very well. What is the patient, the population, or the problem in question? That you have to be very clear. The intervention, what is it that you're trying to do? So what is intervention or treatment that you are interested in? Then it has to have a comparison. If it does not have a comparison here, you have to wonder what type of research it is. Doesn't mean it's not a research, but you have to wonder what kind of research it is, because what are you doing? What are you comparing it to, so that you can give us an answer that helps us advance our knowledge. The whole idea about research is to advance knowledge. So you have to have a gap in the knowledge that you are trying to observe. So comparison, what is the alternative to the intervention that you have selected? Outcome. The outcome is important. The outcome is not the activities. I always make fun of people when I talk with them about outcome and activities. I said, if I ask you to make a cup of tea for people, and I come in and say, so how did you do today? You say, oh, today was really, really bad. It was a busy day. I got the water, I put it in the microwave, I heated the water, I poured it in a cup, I put a sugar, I put a milk, I put honey, and then I stirred it, and then I put it on a saucer, and then I brought it to one person. The outcome is you served one person. All of those activities all led to serving one person a cup of tea. So activities are not what I'm looking for. That's not what people are looking for. They're looking for what is it that you hope to accomplish. You want to serve people tea. You can have 20 activity and you serve one person. But if I come in there and say, oh, today was good. I served 50 people today. That's my mind, 50 cup of teas. That is how the business person will look at it. The person who is funding you will look at it. The population will look at your impact. Oh, wow, you served 50 people today food that didn't have food. But everybody who knows about what you do will say, wow, it must take a lot to serve these people 50 food, because I know that there is 20 steps to serve one person. So, but the outcome has to be clear in terms of, so what? The answer of that question is important. So what? That was everybody care. And I'll tell you this story because I think it will help you remember this. As a fellow, during my training, I went to my professor, who was well known, Professor Lesky. He was one and his team that described the first pediatric HIV patient in Newark, New Jersey. And at the time, the New York Times called him the alarmist doctor. He actually framed it and put it in his office. They put his hair is all white hairs. They said this doctor is talking about something we call the gay man disease at the time, that he's talking about seeing it in children. He must be out of his mind. He's an alarmist. There's no way the children can be gay. Because at the time, they thought that all HIV was caused by gay people and that's the only way of transmission. But nobody has thought about that it was a virus. Nobody has thought about that it can be transmitted from people to people, and then, of course, to a pregnant woman, and, of course, to a child. So I was so intrigued. That was why I came to the place to do my fellowship. So I got him one day. I thought I cornered him in a corner when he was seen quiet a little bit. I asked him, I said, Professor Levsky, how do you decide which area to research, which area to focus on? He turned to me, he said, read the newspaper. So he continued to do what he's doing. I scratched my head. I said, this guy doesn't want to answer me. In my mind, I just came from Nigeria. I said, he does not care for me. I'm a black man. And I can give all the reasons that I could think about at that moment why he didn't want to answer me. So I decided in my mind there was no need to ask him. He doesn't want to answer. So I kept quiet. We ran our clinic for about 4 hours. At the end of the clinic, he called me and he said, "You didn't say anything to my answer." So I said, "Oh, I understand if you don't want to answer. I'm sorry I asked." He said, "No, but I answered you." I said, "You told me to go read the newspaper." He said, "Yes." I said, "What has newspaper got to do with this?" He said, "Who do you expect that is going to, do you want your research to be funded?" I said, "Yes." He said, "Who do you think that is going to fund it?" I said, I'm thinking about NIH. He said, "How do you think NIH gets the money?" I said, "Taxes." He said, "So NIH gets the people's money, they take the people's money and they give you to do a research. So who cares about your research? Who cares what you're working on?" He said, "If what you are working on is now what is the problem, it's not in the news, meaning in the news doesn't mean in the TV and those things are there, but it could be." That's what he was trying to tell me. You need to see what people are talking about. If every day in your community you are getting up and there's another accident on Bini Lagos Expressway, that this, and then you're saying, this traffic accident is a problem. What is the main cause of this traffic accident? Is it poor maintenance of car? Is it drunken drivers? Is it no pedestrian crossing? You are focusing when you come in there and said challenges to or intervention to reduce traffic accidents in Nigeria. Suddenly you're talking about what the people are talking about. But if the people are talking about Tinubu and you're talking about Trump, trouble because you live in Nigeria. So you want to be able to talk about what the people are focused on. What is their problem? What is it that if you actually somebody say, really? That is my problem. Or how to pay, if you go into newspaper and then the first page of that newspaper, how to pay for your children's school fees. You will know that so many people are going to read that. Why? Because everybody is in trouble. They want to know how to pay for their children's school fees. So you have to be able to make sure that you pick those things that are out there. Of course, we talked about the time being optional as we move forward. So here again is going to give you there. I'm not going to go into detail of this, but I want you to look at the topics in the terms of the title of them to identify the problem, to analyze the gap, to formulate your question, to define the scope, and then of course you refine your questions. Some of these things that I'm coming here, the first four that are there, I always say these are some of the things you have to do to be able to put a team together because good research is usually not done by one person. If you see one person that said they did a very good research, they are very, very different kind of people. That means they're very unappreciative of the whole lot of people who worked on that project. That's what it means because one person can do a lot of this work. First of all, you don't have all the expertise needed to do that. So I have a master's, I have an MD, I did my residency, I did my fellowship, I'm board certified in pediatrics, but that does not make me a statistician. When I need a statistician, I still get one in my team, even though I can understand what they're saying. But they're the expert in this area. I want them to write a section on statistics plan. So again, when you have those four areas, it helps you to attract the right person. When people want me to work with them, they send me a concept note. I'm looking at it and say, is there a clear problem? Is there a clear gap here they're trying to solve? Is there a clear research question? Is there a scope to it? And then I can come in, and that's when you put that thing together, that's when there's a refined questions because they will now bring in the statistician will tell you, oh, this, the methodologists will tell you what research design. So there are so many things that start to come in here. But if you look below each of these topics each of these titles that we put in here, you see those things we're talking about. Determine what knowledge is lacking to solve the problem. Craft a clear and concise question. Set the boundaries of your research. When you see those things and you see somebody coming in with 12 aims or objectives, that is somebody who have not written and gotten a grant before. Most of the time, if it's a research question, the narrower they are, the more specific they are, the more pinpointed they are, the more likely that everybody understands what you're trying to do. So we're talking a little bit about all those things about, again, clarify relationship and outcomes using, logistic model to visualize connection between your resources, the activities, the outcome. There is a lot of them that is there, but it's something that you want to use to actually define as you build in that problem. Again, if you don't have the skills to do this, it does not mean you cannot do research. That is a question that I always tell a lot of people. Please don't think that you alone has to have the skill to write all the things, do all of them, and publish by yourself. That is not nobody is going to shake your hand because it's really not if that, you want to be able to know that if you have maybe what you bring to the team is just the idea, and then you're able to put a team together. And then you have to actually, I say that in a lot of the project that I do, I may not even be the one who has the idea. It may be one of the people that is in my team, but I have all the skills that I can bring in there to take that the idea that they have to put a team together to produce those things that are there. So when you think about it, remember that you don't have to have all the skills needed here. So you may not understand how to take logistic models and be able to build out there. You can have people there and say, this idea I'm telling you is because of the problem I'm seeing where I am working. I serve people with HIV, children in the OVC program, and this is the problem that we have, and I'm figuring it out. And that may be all that you bring to the team. If you have a good team, what they will happen is that they will retain you as part of that team, even though you may not lead that project because you may not have the expertise. Maybe you have a bachelor's, you don't have a master, you don't have a terminal degree, but you can be a very important thing. What I normally do, if you come to me with this kind of idea, I said, okay, we're going. This is a very interesting idea. I like this idea. I'm going to try to put a team together so we can build it. But you are going to remain the research manager for this project, which means you are going to be in charge. So, which means when we're doing budget, you are the first person that is 100% on this project because this idea, you actually be able to translate that. So these are some of the things you have to think about, that you don't have to have all the skills, but these are the things that you need to develop a good research questions. You want to be able to do a root cause analysis. There are no raising hands, so follow the instruction. If you have questions, please put those questions in the Q&A and we will answer them. I promise you. You will like it when we go there. We will answer your questions completely and well. If you put it in the chat, we will not answer them. If you raise your hand, nobody's going to ask you to speak. Put those questions in the Q&A. So so you do a root cause analysis, and that's one of the things you want to build here. You have those problem tree that helps you to visualize, map, and central root causes and effects. It aids the researcher in identifying an underlying problem and formulating the target questions. Then you want to develop implementation strategies, that what we call implementation mapping. Each of these things I'm talking about, we also provide training for them. So you will see in some of the topics that we go along the year, we might focus on something like implementation mapping. How do you do that? Yeah, while you may not be the one to do it, you may need to understand that implementation mapping is an important process for you to develop implementation strategies. So even if you're not the one, when it's being done, you say, yeah, I understand that trying to do an implementation mapping to identify the strategies. You don't have to be an expert. You can leave that to the implementation scientist. Everybody does not have to be an implementation scientist in your team. They bring in different things. If you have a team of 5 people and 5 of them are implementation scientists, that is not a team that is going to win a grant. That is a team. If you have 5 of them and they're all pediatrician, that is not a team that is going to win a grant. Yeah, 5 of them, they're all oncologists. That is not a team that will. You need people with different expertise that come in. Somebody who their idea is on research methodology, designs. Somebody who the idea is on analysis, analytical plan, data management. Somebody who the idea is on the content. You can't write something on oncology without an oncologist. So you need an oncologist, unless it has nothing to do with oncology. So you need somebody who has a content expertise. So just remember that each of these things I'm talking here, a lot of what we want you to learn during this process is not for you to become an expert in each of them. It's for you to require and understand what is needed so that as you're moving along, even as you're trying to say, who do I want to work with? I have this idea. Who should I go with? Then who should I go? Then you have that. We have a 2 to 3 hour, we call it research in progress in our team. And this is allowed for anybody in Nigeria that have a research question that you're working on. You go through the process we have, you sign a non-disclosure, it protects you, it protects us. What the non-disclosure says that when you send the question to us, we will not take your question and work on it. And we have done that for the past 5 years. So there's not an idea that we take. Once you have those signed, that is there. You can hold me responsible for that. I have nothing at this stage in my career to benefit by taking people's idea. What we are looking for is to take your idea to see if it's there and see this is a good idea to build a team around you and be able to help you with the skill set that is there for you to submit this. And then along the process, you learn. So we spend these 2 to 3 hours every Monday for 50 weeks. We have done that for 5 years now. And that is something that is important for you. But when I'm saying this is for you to see those aspects that you need understanding that all the skills does not have to be you, but all of those aspects are needed for you to be able to do this. So let's go to think about a problem and how you try to develop things from there. So, like I said, real world problem. There's a rural hospital in Nigeria. They report a significant high rate of post-surgical site infections, which means they did a C-section, they did this, and after that, there was an infection of the site among their patients. So they went back and said, let's follow the guideline. And the guideline says standard antibiotic prophylaxis. So everybody they did the C-section or this surgery on, they give them antibiotics. When they check again, their infection rate remains above national average. There are two things here. First of all, you have to know your infection rate. You have to know what the national average is. So that means existing data. You need to have knowledge about data. And that's why collecting data is important. One of the biggest problems that we have in Nigeria is that when we want to raise a question, we think that that question is opinion. That's what I think. Who the heck are you? So for me, thinking about that's what I think is the problem. Who the heck am I? So you want to be able to look at the data in the country. Said, okay, that everybody is doing what they're doing in HIV. How come we are still having 10,000 children born with HIV in Nigeria? That becomes but you have to know how many children that are born in Nigeria and what you used to be. Is progress being made? So those things are important. So, but when you understand it, so this is the problem that led into that. So they found out that we can't reduce this infection rate. And when people have infection after surgery, they stay longer in the hospital. It costs more money for them, and then the patient goes back very unhappy with our team. So the hospital is trying to figure out how can we solve this. So they have a practice gap that identify. They don't know what is causing this because they have done they have done the antibiotics. They have tried to figure out what it is that is there, and they can still do that. So they have this limited understanding of content-specific factor that is contributing to the surgical site infection in the rural hospital, particularly regarding surgical environmental conditions, sterilizing practices, and patient education and wound care. So all of these things are things that are happening. So now you want to be able to try to turn it into a research question because you have felt in your mind that you want to go to somebody and say, oh, I'm going to reach the prof. I'm going to ask him to see if he can join us in this study and be able to do that. But I want to be able to attract him by making sure that I have a very clear research question. So you see that. So you now use the PICO framework and said, I remember the day he was talking about it and he talked about the PICOT. And then I'm going to try to break it down and say that. So the patient, so what is that patient undergoing abdominal surgery in rural hospitals in Nigeria? So my patient population is clear. Okay, what intervention? So I have developed this bundle of things that I want to do of prevention, the protocol, which is sterilization audit, perioperative patient education, improve wound dressing, that I want to test. That if I put these things in place, what happens in Nigeria? They just do it. And then they finish doing it, and somebody in Malawi publishes that paper. They say, "Oh, we did that before," but but nobody knows what you did in your backyard. So because they won't spend the time to actually develop the guidelines to be able to guide you to be able to do that. It happens in every part of the world. It happens in all African countries. And that is the things that people try to do. Is that if you are working, remember, it is not about your site in Enugu, your site in Ibadan, your site in Kano. It is about what do you contribute to the scientific world that somebody in Kenya can see, somebody in South Africa can use, and somebody in the US, in Australia, in Canada can use. So you are contributing to science. Science does not have limit of location. So when you are doing it, and the only problem you're solving is there, but you're solving this problem to say this is the problem that we have. This is the what we put in place, and then this is the result we found. Somebody else, somewhere else in the whole world, will see that and say, wow, this is the problem we're having. That's the problem we're having here. This is what they did. Okay, so let's do that and see whether we are going to get the same good outcome that they got. So here you have a very well-defined intervention bundle that you want to do. That the comparison is here. You have your standard care with routine antibiotic prophylaxis, which is the thing you did, and is the standard guideline, but it didn't help you. The outcome you're looking at here is reduction in post-operative site infection. So what is very good about looking at this PICO is that it is clear. So when you send it to me, I say, wow, I like this. There's a very clear population that is focusing on. There's an intervention that is identified. There's a standard of care that they want to compare to, and there's an outcome that is well defined. So that is how you begin with that question to be able to identify those inclusive questions. So now you come in with that final question. Say, does implementation of the bundled surgical site infection prevention protocol reduce the incidence of surgical site infections compared to standard care among patients undergoing abdominal surgery in rural hospital, Nigerian hospital? You see how your research questions finally come. Very good from those breakdown that you did of the PICO. So I'm leaving it here for you to look a little bit around. I'm going to take you back to that, how you broke it down before you got there, to be able to define the population, the intervention, the comparison group, the outcome that you come back again to the research question that you have. Beautifully done. That's what we hope that this opens out opportunity for you. Things for you to remember. Don't be broad. Don't be vague. If your questions are broad, it's not the bigger, it's not the better in terms of research. People who are experts, people forget this thing about experts. Experts are the people who know so much about little. That's what makes you an expert. If you know so much about so many things, you're not an expert. That's why people will remember, they say, this person is a professor of the 2% area, of the 1% area. All he has studied, all of this is the thumb. And he's a surgical person that has focused on thumb infections and or thumb surgery. So if you're working and the machine cuts off your thumb, they say go to him. He'll fix it. He is professor of the thumb area. Those people, you go to there and you say, I have a headache. They look at you like, what? And you say, aren't you a professor of medicine? Yeah, but this is so the more people specialize, the more they narrow down to a specific area. So as you start to ask your question, start big. There's nothing wrong with starting big. That is why I talked about that this is not the first thing that you do. The first thing you do is what research area? What is that? Reading the newspapers. So reading the newspaper in this case, reading the literature. What is there in the literature? What is the gap in literature that you've seen that there? Then begin to narrow from there to come down to your questions. Your question cannot be answered. So don't do questions that cannot be answered with research. Like I said, poverty. People have tried to do that. I don't know anybody who have been able to develop a research and cured and define an answer to poverty. Because what people define as poverty is different. How you cure poverty in different areas is different. What you use to cure poverty is different. Maybe all people want is to eat and have a place to cover their head. And if they can cover their head and eat, they're not poor in their mind. Whatever else you drive, different car doesn't matter to them. So again, don't set up questions that you set yourself up to fail. It is important for you to think about impact and relevance. So start your project with stakeholder. Start your project with who does this problem matter to? Speak to them. Who can help me in doing this project? Think about the people. I don't work without talking to in my own area of research, I do not work without talking to the implementing partners, the IHVN, the APIN, the CCFN, the AQs, all of those people who are doing this great work on the ground. If I want to do research, I go to them. It is not a thing I go to them and say, I was thinking about this. Is that a problem that you really see? They might tell me, oh no, Prof, no, we had that problem 10 years ago. We solved it. This is all we did. And so that my idea will go away. I come back again with another one. I have this idea. Is that so? You need to talk to the stakeholders, and stakeholders can be patients, they can be implementing partners, they can be policyholders, but they help you to begin to build your questions and define them. Again, get your questions. That's how you're going to get them on the table. Then you go to them, but recognize that they are very critical to you in refining those research questions that you want to have. So let's take a look at another poor versus an improved research question. So a poor research question is, does palliative care help patients? Well, I don't know what the heck you mean by that. But so I'm looking at that question. That question is vague. It doesn't specify any kind of patient population. What aspect of help? What is help? How is help measured? What is the outcome for help? It's too broad. It lacks focus. It has direction for research. It's not a research question. That is in what they call it. You want to have a discussion. You met a palliative care person at a party and you're trying to strike a discussion with them. You say, oh, you say you're a palliative care physician. Oh, does it really help people? Yeah, those are the kind of things. And you have a glass of wine and they have a glass of wine and you engage them and you talk to them, you listen to them. At the end of the day, It is important because you get, you now had a network. You have met Professor Nyeka, who is a palliative care expert, and now you have her number and you have her email. And if you're going to do research, you can reach out to them because what you just ask them is not a research question. But then you can change those things and go back and say, what is the effect of integrating community-based palliative care on pain management outcome among adults with advanced cancer in rural Nigeria? You see how that question is. That question is specific. It targets population with advanced cancer in a defined geographical population. Is measurable. It focuses on pain management outcomes. It's contextualized. It tells you about the community business in rural Nigeria. It's researchable. It allows for clear study design and for data collection. So I'm hoping that this is going to be there. So what are funding agencies looking for? It's a question that aligns with the funding priorities. So before I write grants, everybody in my team knows that I read the enough for the funding opportunity with colors. I mark it like a high school person, different colors for green, yellow, and red. Green for pay attention to this. Yellow, this is important. Red, you can ignore this. Or the other way, red is wow, you need to pay attention to this. Yellow is up, so you can use such question. I want to make sure that it has clarity and that what I'm trying to do is feasible. I cannot cure poverty, not yet. Maybe there will be down the road, but I can cure poor education, which can come out from being poor. So it can increase education. It can increase knowledge, even among people that you consider poor people. So poverty is not a definition of that kind of research program that is there. Unless you have a lot of money and you say, I am Elon Musk, I have 300 million billion dollars, and there are how many people, billion people in the world, and then I can share 1 billion to everybody for whatever the amount of money is and see whether the world will be a better place. I can tell you it won't be, because there are people who will drink your money and finish that money in 3 days. There are people who will buy a car and crush it. There are people who will marry a second wife or a second husband, and people can do different things with this money and they won't solve those problems. So fix out things that are clearly, that have clarity, that are feasible, and that they have a significant, potential for making a huge impact that is innovative and contribute to the field where you are. We're coming to the end of this. So strategies for crafting a little questions is engage the stakeholders early. I talked about it. It is important. You are not alone. You cannot do research. You cannot do bad by yourself. In this particular case, of course, you can lock yourself in a room and drink and get drunk in your room all by yourself. But in this particular question, you can't do all those good by yourself. You need people. So engage stakeholder area, identify the people that are there, identify desired outcome and work back from there. So say, this is what I want to do. I want to find the problem to a solution and I want to work back from there. Of course, select the conceptual framework to guide. I have made this step important here. You don't have to be the one that have the expertise there. You just have to make sure in your team there's someone that has the expertise there. So don't think that you're going to be an expert in all different areas so that you can write this grant by yourself. That is not a good dream. Wake up and said, I have expertise here. I need 3, 4 more expertise. Let me find those people and have a research team. Research teams are what develop good research questions, not an individual. An individual comes out with those initial research questions that interest those people, that bring them all together, and then they refine it together to be able to do that. So again, thinking about those things, thinking about a research question, it does important because once you get the research question, it's going to affect the study design that you use. How do you decide what you're going to do? It's going to look at the outcome that you select, primary outcomes and secondary outcomes. It's going to align, does it align with those stakeholders? So the patient, the policymaker, the implementing partner, the people who will be interested to read your paper when it comes out. Then it helps you to, of course, find tailored dissemination strategies. Those are some of the things that this is going to help you do. A good question, we talked about it, research question, aims, objective, method, ensure specific, measurable, all of us knows about the SMART goals, objective, directly guide the data protection, avoid mission drift. We talk about it a lot because you start with one thing, you end up somewhere, you're like, where the heck was I going? But the more you write and you go back to say, this is interesting, maybe another research question, but to this research question, and I can tell you many times, the reason that you're muted and everybody else is muted because Professor Nyaka will tell you, you have to let Prof know that he has to stick to the agenda. So every time I'm reading, I'm looking for her note to tell me, am I deviating for the agenda? Because people drift. That's human. Everybody drifts. If you tell yourself you don't drift, you're lying to yourself. So we all drift. So that's one of the things as you get your team, they say, focus, focus, Professor Zanolo, focus. So everybody again focus, and then we all try to get this thing done. The reason I'm saying this is the emphasis on the reason why you need a research team, not a research individual. Come up with the idea, but your idea cannot be finalized, cannot be refined, cannot be the best until your team have input to them and make them very well. I just want to end by showing you a little bit of an example of a project that we have currently going in Nigeria. And the research question is simple. What implementation strategies are most effective for integrating cervical cancer screening and treatment into existing HIV program in Nigeria? Every program that we're working with already do this. So get the point. We're not the ones coming to teach them how to do cervical cancer. They're already doing this in all the programs. But I can tell you, when we found out in the 12 areas that we went up, thanks to the nurses, it was 12 nurses that were leading those things, screening those patients. But if you ask them, so what strategies are you using to, make sure that, that you are integrating that instead of 10% of the HIV patients screened, that you are able to get a 70% of them screened. They look at you like, what the heck are you talking about? I said, but how did you decide to do? They just, we got funding and we screen. That's a program, and that's what a program does for you. Without that, and then you come in without that program, you cannot develop a research question. So programs are the core, the base of the program. They are the ones that ask you the question to say, we asked ourselves the PICO question that we used to develop this. Cancer screening, cervical cancer screening, HIV women are at risk of developing cervical cancer. We know that there's an evidence base that cervical cancer can identify early enough and reduce death from cervical cancer. We also know from the program, without program, there is no research. So from the program, we know that about 10% of people, the Clinton Foundation, the USAID, God bless them, supported all of those programs. The IPs, we work with 5 different organizations: CCFN, ACUS, APIN, IHVN, CIHP. There are the 5 bigger that we work in all the 12 sites that are in all the 6 regions of the country. So that our research question helped us to develop our design that we wanted to use, a hybrid type 3. You all hear this about. Throughout the year, we talk about hybrid implementation effectiveness studies, which is not a research design, by the way. I learn every day. It is one of the ways that you use to be able to do that. Of the design, of course, is the randomized trial that is there, is the design that is there. You see the guided by APIs and REM frameworks. Again, in this particular thing that you see here, it has all those things you're talking about. This is funded by the National Institute of Health for 5 years, 2022. When we started, it ends in 2027. But there's 3 main impact we're looking around. We want at the end of it that we enhance screening and treatment services for cervical cancer in HIV clinic across the 6 regions. I mentioned that we have 2 sites in each of the 6 geographical regions. That's the 12 sites that we have. More importantly for us is also that we build in capacity building into this so that we provide healthcare providers the capacity and improve referral completion. We just got a paper accepted. We have a paper being written by the nurses that are working on this project. We have a paper being written by the doctors working on this project. We have a paper being written by the strategic SI team that is working on this. We have a paper that's being written by the IP leads that are working on this. We have a paper that has been written by the CEOs of the organization that are doing this. At every level of involvement, we do that. We actually have a paper that was being planned for the research coordinators, the site research coordinators that are working on all of this, including also the research team. So this is not about one person, it's not about 2 people, it's not about one set of people. We're talking about from the research coordinators to the research team, to the doctors, the nurses, the implementing partners, and at the end of the day, even a policy paper that involves the policymaker that is there. We're also thinking about sustained cervical sector delivery through locally adapted implementation strategies. We are looking about what works in the local setting and how does it work. So bear with me. I think this is about it. I am 3 minutes over. I was told to end at 45 minutes today so that we have a question. But here is just a recap and the takeaway I want you to do. Clarity is power. A focused research question drives your entire research. Your research questions set the direction. The questions shape the aim, the design, the methodology. Be specific. Good questions are grounded, measurable, and context aware. From question to answer, strong questions lead to strong proposals and lead to impactful research. I just want to acknowledge a lot of people that make things that we do. The Nigerian Implementation Science Alliance. The Nigerian Implementation Science Alliance was started in 2015. It is an alliance, as the name says. It's not an organization that have these things. It's an alliance that brought every part of the people that received U.S. funding when we started. So these are PEPFAR-supported partners. These are institutions in Nigeria, and these are Nigerian government that is there. I remember that when we were starting, the people that put the money, people may not even understand it. This was in 2015 that NACA, the National Agency for Coordinator of AIDS, gave us 2 million naira to actually have the first conference. We have three main objectives, which we are completing those of things of them. The first one was actually that conference, which is a platform for us to come together and share the things that we've done so that you can share with other people from your different part of Nigeria what you're doing, what has worked, what has not worked. We went from that dissemination forum, we went to building research infrastructure, and that's why we talk about the ICON 3 practice-based research network. These are 36 sites across the country, made up of secondary health facility, primary communities on the 12 sites like I talked about, 2 sites for each of the geographical regions. So there are 12 primary secondary health facility connected to their primary health centers and connected to the community, and also connected to teaching hospitals across the country. So those are the 36 part of that make up the ICON 3 practice-based research network. We are grateful to the University of Nigeria, the academic institutions that help give us a home, where the Urban Research Institute give us a building where we are. So we're very grateful for them because from there we can bring this to you without a lot of cost to them, and we're able to bear the cost that comes with some of the things that we do. But I want to make sure that I'm grateful to a lot of the people at Urban Research Institute that put all of this together every month for you, and then every week for the research in progress, and also support the Nigerian Implementation Science Alliance for the conference. This year conference is in September. Please try to be there. The host for this year is Solina Health. They are going to be the host, and the Urban Research Institute will be the co-host, working with them. The way the Nigerian Implementation Science Alliance works is that it rotates among all the members. APIN did it for 3 years. IHBN have done it. FHI has done it. AQS did that 2 years ago. Last year was CCFN. This year is Solina Health. Next year will be another organization. It's truly an alliance that allows our country to move forward in terms of research, in terms of capacity building. Like I said, there are so many opportunities to do that in Nigeria. If you go into if you don't have a LinkedIn page, go to there, follow me on LinkedIn. What I do is that I see wherever there is a training in Nigeria, I put it on my LinkedIn page so that people can see different training. A lot of them are free. Some of them you pay for. Some of them, some components are free, like our own, and some components, you pay for. So, but you can get a lot of opportunities to be able to train there. So let me stop, and then we will go to the Q&A. And thank you everyone for coming. And then remember that you can always send the topics that you want us to focus on to us, and the email will be in the chat. You can send it to us so that we know that what we are bringing, that is something. You are the stakeholder here. This, whatever we do, does not make there are close to us that are 300 people that are here throughout the time. You are the stakeholders. You are the one that is not important to us if we're talking about things you don't care about. So we want to hear from you. So please complete the questionnaire at the end. Tell us the topics you want us to see about. We want to see the topics next time. We are already writing out the topics for 2026. That's how far we plan. So we are thinking about, as we are giving these things, we are saying, okay, what does this do? What gaps do you see? What area do you want us to speak about? What area do you want us to bring a speaker? I'm not usually the one to speak around. Yeah, today was actually meant for our speakers from NIH, but of course, of all the things happen, we moved that a little bit in June, and you're going to see a whole week where you're going to see speakers from NIH come to speak a little bit about focusing on building our science and knowledge, not on anything else that is controversial. So, Sonia, thank you, and I hope I left time enough.
Yeah, there are a lot of questions, but I think we can still surmount them. So the first question is from Professor Oselo Kekwem is asking, what is the relationship between the statement of the problem and the research question?
So a statement of the problem is what it is. It says what you are, what is the problem you are trying to resolve. When you begin to convert a research question to a specific end page, we have talked about it in this place. We have developed what we call the 5 easy steps. We talked about it many times. What is that? We say, what is the problem you're trying to solve? So that is one part of it. Then when you get it, I say, what do we know about the problem you're trying to solve? Then the third thing is what the gap exists. So when you come to a research question, then you say, what do you propose to do and how are you going to do it? That is the 5 steps when you're writing those things. So when you go back, a statement of the problem just says you what the problem is. A research question actually asks, you have to say, act some of those part of these things, which is the gap. He addresses the gap and addresses what is it that you're trying to solve here. So the concept might say, this is the problem. Let me give you an example. And then this is a good example I want to use to show you here. The statement of the problem here, you don't see it in the research question, but if I were to add a statement of the problem, what I would have just said, despite HIV, cervical cancer screening being a proven intervention for reducing death from cervical cancer among HIV-infected women, only 10% of HIV-infected women have been screened for cancer. That would be my statement of the problem. So by saying that, you understand what the problem is. That's what it does. The problem is that despite all of us knowing that cervical cancer screening is a very critical intervention to reduce death from cervical cancer, only 10% of women with HIV have been screened for cervical cancer. That is a statement problem. It doesn't give you any research question that you can research on. But from there, that's what our concept, from there, we now develop the question and say what implementation strategies are most effective in integrating cervical cancer screening. So a research question develops from a statement of the problem. I don't know if that answers Prof's question, but if not, please ask it again so I can address it.
Okay, so Dr. Wosho is thanking you for the very useful presentation and says, it seems having a good research question will include avoiding terms and concepts that funders object to, like diversity, women. So how do we get information about such terms and concepts to avoid when thinking about the research question or when writing a grant application? So I think Dr. Wosho is alluding to the recent changes in the National Institutes of Health with regards to what to put in your grant and not what to put in your grant.
Yes, so what we have done is that we have compiled, it's a changing thing. So we have compiled things that we have gotten from so many different sites about things to avoid. Remember, these are temporary. The last 4 years of the Biden administration to increase diversity was what everybody wanted. So there was a need to, but remember what diversity is. Diversity is the same reason why you build a house in the US and you put in a ADA so that the people who went to war in Iraq and fought for our country and got their legs amputated can ride on a wheelchair and come up to the building. That's diversity. That's inclusion. Okay, so the word is not a bad thing. Because those people, if not, then why do we need to put them in there? No, then they should climb the stairs like everybody else who have 2 legs. But I'm being political here, so I know that. But those are because when we think about diversity, we think about diversity as if we're giving things to people who are not merited. This is a soldier who went to the Iraq War and fought for the Iraq War and got their legs, and we're building our houses to make sure that they can still be included, that they can get up to those staircases by using the ramp. That's inclusion. So, but in this new government, we can't do that. So we all understand that. And unless your grandfather is going to fund this, you have to follow the rules. So that's the rule today. So what we've done is to compile a lot of those things you shouldn't use. And in our next monthly webinar, we are going to be presenting that. So I think that will be very helpful to you. So look out for it. It's going to show you the things that you should avoid. We are learning, okay? But whatever we learn, we're going to be willing to share it so that you can also understand the things to avoid. I can almost guarantee you that when this time is ended, we're going to go back to this. So don't throw away your diversity, equity, and inclusions. because it depends on how you define them. Those are not bad things to happen.
Okay, so Confidence is thanking you again and asking that before committing significant time and resources to a research project, how can early career stage researchers assess whether their research questions are valid, relevant, and feasible? Are there any specific steps or techniques that they can use to evaluate the strength of their questions early as they design their research?
There's one single word I say: mentoring. The reason we have a mentoring program, most of you have heard about the CITIA Scholar Program. This year we got 168 application. We are supposed to start already. This part of what we're doing today is part of that program. We have started more, but we're trying to challenge we're having is that the people we selected more people than we have mentors for. So they're very good ideas people have that we selected. But we have decided as a team that we will not take anyone that we don't have a mentor for. So why am I saying this? Please, if you are here and you think you can mentor, you think you have had an experience writing grant and you're willing to give back, like all of us here. So we don't pay people for mentoring. We do provide some resources for you in certain things to be able to do that. But one major part of that is that if you're a mentor, you also join our team where you can bring in your own research designs, and then all of us can give input to you at no cost. But you can only do that if you are part of the mentoring team. So that means you are giving back to the general early stage investigators. But the mentoring team is a very important thing that we have. And that is where we have that you can send in those questions and we can assign you a mentor to be able to see, and they can see if your questions are there. But because we can't take questions from everyone, that's why we're giving this Monday one, that is everybody is here. But if you got to a place you think you have a research question that you have developed in a career plan and you want to see whether this is an interesting thing, you can send it to us. And again, we will respond to you. And if it is, well, what we'll do is that we'll invite you to present it in our meeting. Our Monday meetings is apart from the first Monday when we do this, the other days we spend these 3 hours looking at people with their questions, with their designs, with their decisions. So we will invite you to present it there and then go from there. So mentoring to me is important. And if you don't have access to us, that's going to be in your institutions. And there are many different teams in Nigeria that support this kind of idea. But I think for early stage investigators, one of the things you have to, it's difficult to succeed by yourself. And it's not designed for you to succeed by yourself. It is not I'm a self-made man or woman is a story. You actually need people to be able to help you with that. So a mentor, identifying a mentor. A mentor is different from a supervisor. A mentor is somebody who really have interest in your development, who really want to invest in you as a person to develop. A supervisor, of course, if you're doing your PhD or your master's, make sure that you complete the master's and those things. But a mentor goes a little bit from that. They're the ones that tell you things that are not actually taught in the classroom. You do need a mentor. I think that's one way I would say that instead of trying to tell you how you can do it by yourself, because most of the case, you don't know what you don't know. A mentor will be a good person that can guide you.
Okay, Prof. Glory Ojinaka is asking, must there be an intervention in research questions? For example, a public health professional who wants to understand the barriers to care is not intervening. Does that mean that such research is not fundable? It doesn't have a comparator. So does it mean that it's only research questions that have comparators, that comparative studies are funded? So she's asking two questions here. So the first one is that if she has a research that's just looking at barriers to care, does it mean it's not a fundable research?
So to me, barriers to care, we again we wouldn't cover another area, but I can almost guarantee you that it will be very difficult for that to be a major research question. So you have to look at the type of research. We just picked one and we picked the biggest, which is an arrow one. I'm using NIH for the NIH is not the only one. And maybe, the way things are going may not even be the second largest as it has always been for this many years. But it was the largest funding agency in the world. So that's why we use NIH everywhere, every country. That's when you see the cut in NIH, it affects every country because it supports research in almost every country. So cut to NIH means a lot for every researcher in the world, no matter where you sit or stand or lying down. It affects you. But it's not the only funding agency. But the reason we pick NIH in our sample to do this is three reasons. One, every application that is submitted to NIH is actually reviewed by 3 people at a minimum. Every single proposal. I reviewed grant for NIH for 10 years, more than 10 years. They review grant. Why is that important? They give you feedback, and that feedback is training. That is how I train. I was the first person to get an NIH grant in my institution. I trained by submitting grants and getting feedback from the people who review. So I'm very grateful for the National Institute of Health. So we use that as an example. And then if your grant is actually getting to the top 50%, half of the top of the 50, you actually reviewed by 16 people and you get a summary statement. We have discussed here before, and we will do in the future, about a summary statement, what it looks like when your grant are reviewed. And you can see the feedbacks they give you, strength, weakness on every area. Very good training. So we use that. So the NIH has 3 main levels of funding. The small level of funding is an R03. So an R03 is when you're trying to generate those things. They can fund determining the barriers on those. But determining the barriers is not so that you can write a paper. The thing I see a lot of people is that they design their research as if they're writing a manuscript. They're not the same thing. A systematic review is unlikely for NIH to fund you to do a systematic review. That you should do without funding. It's when you don't that, you have actually identified from the literature, but you wanted to conduct a focus group, a nominal group technique, or what kind of other things to be able to elicit more things from people. That requires money. So, but if you're saying I want to put a research proposal so I can do the systematic review, you're not going to get funded. I want to make sure people are clear about that. But if this is part of your initial development of the project, so you have a project and the M1 is going to be that you have read the literature, you have come up with the gaps. Because if you haven't read the literature, you haven't done your part. But you have now found it and you have a research question, which is, let's say you said in the literature they say this, and your research question is that, what those research questions you want to see, you want to co-create that thing now. So now you're taking those questions that you have from the literature. You want to go back to the HIV infected women or men to co-create with them to get their input into this question, to refine these questions, to refine the interventions they are doing by understanding the barriers from them and all of those things that you will get funded. So it depends on how you integrate them. When you say, I'm going to do barriers, and I always tell people, we have a lot of papers describing the problem with Nigeria. We don't need anybody else to tell us what the problem is in Nigeria. But if you're saying, I've seen all this problem in Nigeria, and I'm trying to map which ones to focus on for an intervention. And to do that, I need people in government, I need people in the implementing partner, I need people in higher institutions to help me refine and co-create these things. You will get funded for that. So it depends on how you're saying your barriers and facilitators. Nobody is going to pay you money to say, go to the literature and do that. That is supposed to be something you're supposed to have done to determine the barrier. Because if you don't know the barriers, then how do you know what the gap is? So funded research usually are focused on that. Unless in that first part is not done. So let me tell you example. You want to see about what is happening with leprosy. People don't even think leprosy still exists, but it does. And you said, oh, I want to be able to identify them. And you went to the literature and you didn't see anything on leprosy. And, or you don't see anything for people asserting that. So for those kind of work, barriers and facilitators, you have to actually use them when you are doing for a funding grant. You have to use them as preliminary study for a big study. The R03 can fund that initial part. But the arrow ones will not fund you, which is, I mentioned 3 parts, right? Arrow 3 is a small grant. It's 50,000 naira, $50,000 for 2 years, not more than 2 years. It doesn't have to have a hypothesis. The R21 is another 2-year grant, but a little bit more money, 125. A lot of the money that is there is actually, NIH is actually time. NIH does not give money like programs give. NIH pays for time. So it's only time. So the investigators, they are recognizing to do research that you have to do it with 5 other people. So and then this set up people like me, and you want my time, then you got to pay for that time. So the money NIH is giving you is to be able to bring somebody like me, like people like me. So not just me, but people like that to be able to be part of your team. And they require money. So there's a lot of those money. 75% of those fundings actually go into people.
Okay. So, yeah,
Go
okay.
ahead.
So, sorry. So there are a
No,
lot of
cut me off when I start going. Remember what I said? We all drift. So
yeah.
bring me back.
Yeah, so a lot of people are asking this question, do we have to, because they're thinking about the PICOT, some ask what's the T, of course, T stands for time frame. So, but a lot of people are asking, do our research questions have to have, things about comparators, the C in the PICO?
So again, if you are going to do a research question, so I see a lot of confusion in people when I ask them to send in there, they think of a manuscript topic as a research question. So there are different kind of, when I put research as part of what I call scholarly work. Manuscript development is a scholarly work. My team will tell you that I am not interested in manuscript development by single in terms of that, except when that manuscript is feeding into a research or that manuscript is a result of a research. That does not mean they're not important. It just means the space where we want to be. Like I said, there are so many different teams in Nigeria, and we want all of them to be able, and they focus in different areas. We are not interested in just a research, a manuscript there. But the manuscript, there are part of the manuscript that are important for you to do a research project. So for us to identify the gaps and everything, most of us in our team, we actually do that on our own. We fund it, pilot studies. So they can be funded through pilot to be able to do that. But for you to do a major research, which is where we're trying to get to, there are small fundings, 2,500 that we actually fund some from our institute. So we fund that. This year that is coming around, we set out 10 million naira to be able to fund those kind of projects. So if you have a good idea in terms of, and we think it's going to be something that will help you, we call it preliminary studies. We are doing about 7 of them right now that will help you to prepare for the proposal. But we're talking about a proposal where you're going to ask a funding agency, and like I said, we're using NIH as a start to be able to do research. They have to be preliminary things that were done. A lot of people come in with those preliminary questions that need to be done. Barriers and facilitators. If you don't know what the barriers are, what is the problem here? You need to know what the gap is. But how do you know the gap? Unless you're telling me the gap is there because we don't even know what the barriers is. Nobody's such a new thing. But I guarantee you, most times they come to me, they say, oh, we want to know the barriers because it's not known. I just type it in that place and show them. Look, there's 200 papers on this. Well, it's not known in Enugu. Who cares about Enugu? So again, you are not developing things about Enugu. You are developing things for science that somebody in Enugu, in Ibadan, in Kano, in the US, in Canada, in Australia, to use to think about the larger picture of the world as contributing to science, not contributing to Enugu. If you want to do it in Enugu, of course, the Enugu state governor can support that and fund that. So when you want to do a research project that is actually going to be there, it has to be, unless you're doing a field where nothing is known. And that is where those arrow 3 comes in. That arrow 3, so it can be funded. So not all your research questions have to have experimental design. What we explained today was an experimental design where you have an intervention, a control. Those are mostly the funded research. So what we focus on in trying to talk about today, and our team focus on, is on funded research projects. There are a lot of things. There are research projects. There are questions of interest, but then most of them are not fundable. There are things that you need to be able to find with small fundings to be able to do. Pilot funding, doing your PhD, doing your master's, projects that are used for master's. Those are funded in that context, but not in terms of the large, let me go to NIH and compete. And I'm using NIH as an example. You can be NIHR, it can be the one from Australia, the one from Canada. There's so many different areas. Again, when we talk about NIH, remember it's not the only funding agency. We all know that now. There are many other ones, but we use it as an example. So if you're going to go there, you need to do that. But there are small things that fund those kind of initial questions that you have, barriers and facilitators. If those things are not in something that is new, like when COVID came in, barriers to receiving, many people got funded during that period. But right now, if you say you're going to look at barriers for receiving COVID vaccine, you're not going to get funded because about 300, 400 already that have been there. But when it came out newly, so timing is very important in terms of, so if something that is new, Monkeypox. Oh, that's new. What the heck is that? That is that. So if something new comes up, bird flu, or something comes in there. So there might be those initial things. But most of the big funding that we have aren't going to fund a standalone barriers and facilitators unless it's built into the research. And when we talk about developing specific you see how those are built in. When you are no longer saying you're looking at intervention, you may actually need to get more information on barriers and facilitators. So it depends on how you present it. That's my question. I spend more time here so that people can, since you say a lot of people are asking that question. And
Okay,
what
so
we might do next time, just to remember, Professor Nyeka, next time we may actually create a place where before we do this program again, send us some of the idea that you want to think about. What do you think? Is this idea? And we can actually use 15 minutes and actually look at people's questions. And if you want to type something in there, if we have time, Professor Nyeka, we can look at it.
Okay, that's a good one. Okay, so very quickly, I know we're 15 minutes above our closing time. Someone's saying that from your teaching that he or she can deduce that research teams keep changing because you need different expertise. But he's always
Absolutely.
taught that the team is static. So
No,
which is
anybody that taught
correct?
you
A
that is
static
not
research
true.
team or okay.
Anybody that taught you that were from the past, not present. Research teams are not
Yeah.
static. Research teams are static for the project. It changes with each project. So if you were looking at, let me use barriers and facilitators to cervical cancer, and you change that and say barriers and facilitators to prostate cancer, are you going to need the same people? Maybe you need a prostate expert, not a cervical cancer expert. So there is no way research team can be static. Research teams are dynamic.
Okay, so Juliet is saying she's from Ghana and she wants to know whether we have a collaboration with other African countries.
We do. We actually have the African Regional Implementation Science Alliance that is in most African countries. That we have partners in Kenya, we have partners in Tanzania, we have partners in Ghana, we have partners in Botswana, we have partners in. So we have in every country. This particular thing we present. Maybe Professor Nyaka can give you time. We usually have people signing in from many different African countries. And more importantly, we are open to that partnership. The particular project that we have now, we were advertising, we are looking for people from 4 different countries, Nigeria, Tanzania, Zambia, and what's the other one? Yeah, Kenya,
Yes,
Tanzania,
Kenya,
Zambia, and Nigeria.
Nigeria.
So those are the 4 countries. And actually, we actually is going to teach about research leadership in implementation science. So
Yeah, the call
here
is
is a
out.
very good thing. The call is out. It ends on the 15th, so there's still some days. So if you are working on oncology from every different thing, you're a nurse, you're a doctor, you're a public health person, but you're working in oncology, check out that. It's on my LinkedIn page. Check out that. It's on our website at the advancedresearchinstitute.org. They're there. I think we're going to put it also on the NISA website. We're also on the LinkedIn for Nigerian Implementation Science Alliance is there. And if you see it, spread it widely. It's actually a very good thing. So those are 2 major projects that we have. One is that's the City Scholar I talked about. They go on for 1 year. There's a didactic portion, there's a mentoring, which is a critical part of what we do for a 1 year period that is there. So check out that. It will help you a lot in terms of some of the things that you can do.
Yeah, okay. And I think last question here is Yeshida is asking, thanking you for your presentation and say, how do we do research that is novel without showing that the intervention or the program works first? So is it
That's a very
important
good
to,
one.
and how do
Yes.
we get funded? She has 2, yeah, go ahead.
So the things that are novel that without whether it's going to work is also that it can be novel in actual of nothing, right? If I come in and say, a lot of anti-malarials have been used. A lot of them, there have been an increasing problem of resistance to existing anti-malaria. So that is why research has this phase 1, phase 2, phase 3, preclinical. And I'm a biology person. I'm a chemist. And I said, I am dealing with I'm looking at different things. All the malarias have been used. This is what is known, because you have to still go through the same process of the 5 step. What is the problem that you're solving? Increasing resistance to existing anti-malaria. So I'm trying to find new anti-malaria. Second question is, what is known about this problem? So you have to know how the existing anti-malarias work, how the resistance are developed, so you can see something that you can change. And then you now say, what is the gap? The gap is that we don't know how to change some of these places that the resistance occur from, and then we're going to use something to be able to do that. So you have to still come from what is known to what is unknown. You have to make the linkage from what is known to what is unknown. And there is a ton of funding out there for that. Tons
Yes.
of funding.
Yeah, she's
But
also asking for pilot studies. How is it important to do pilot studies, and how to get funding for pilot
pilot studies
studies?
are funded. Pilot studies are funded. Like I mentioned, the RO3 is a pilot funding. Remember when I said RO3, there is no hypothesis needed. So an RO3 does not require an hypothesis. It's 50,000. It must be in 2 years. The reason they do that is to fund pilot studies. So pilot studies are funded. You have to show why it's needed. It's not because the reason I hear most people said, oh, they did it in Kenya, they haven't done it in Nigeria. Who cares about Nigeria and Kenya? What they're caring about is not known in science. Or if you want to say in Nigeria and Kenya, you're saying most of the things that have done intervention here has been in high income countries. Very few studies have been done in low income countries. That is important because that's a lot of countries, not Nigeria or Kenya. That is a lot of countries that fall into LMIC. So it depends on how you frame that. But pilot studies are funded. The 50,000 a year for 2 years for an RO3, most of them fund pilot studies. So pilot studies are important to science because they're the thing that generate the hypothesis. Like I said, in RO3, you do not need a hypothesis. In an RO1, you must have a hypothesis. An RO1 is 500,000 a year for 5 years. Nobody's going to give you that for a pilot study. So you move through an RO3. I'm using NIH again. Every other funding agency have that. An RO3 funds the pilot study. An R21 is also a pilot, but a little bit more outcome that you want to generate. An RO1 is where you test the intervention. So when I'm talking about the PICO and all, I'm talking about the RO1, the big study. But the R21 and RO1, the pilot studies are funded. I don't want you to go out here thinking, oh, the only thing they fund is big. No, but I'm also there's a funding that actually funds $10,000, $5,000. To my first grant was $2,500. My second one was $2,500. My third one was $2,500. So it took a while to build this infrastructure and build the preliminary study to be able to go in there. So don't be looking at, oh, no. Even if it is $500, even if it is, and I stop speaking in dollars, even if it is 500,000 naira, 100,000 naira, 10,000 naira, it is the money that you didn't have. I will apply to every kind of opportunity that I see. A lot of those might come from foundations. A lot of those may come from big institutions like NIH. But look for funding everywhere because every funding, look even internally, like I said, we set out 10 million naira for funding of pilot project every year. But then how do we find those? When people come with an idea, we think this is a good idea. We said, do you want to work with us on this? We give you some funding to go do the pilot.
Mm-hmm. Exactly. Okay, so I think the last question I would like to put out here for you is a PhD student saying they need help in framing good questions. That's students, PhD students, how they need help. Where can they get that kind of help?
If you are a student, you should have some of those things in your institutions. So sometimes you don't think that they don't exist. They exist. So the major thing is going to be, in this case, your supervisor, because you paid school fees. Make sure that you get value for your school fees. So the first value you get for your school fees is actually you're paying for your supervisor's time. That's how they, in the real world, not in our country, Nigeria, the government pays for everybody for the same thing for everybody. But actually, in other part of the world, they pay you for student mentoring and supervision. So you actually supervise, not in a place where some people don't supervise, some people supervise, and then they all get the same salary. No, there's actually a salary difference for people who mentor students and supervise students. So the first part of call is that. But assuming you are in a place that you have a supervisor, but you still need additional expertise to be able to do that. Please reach out to us as so many other teams that are in Nigeria. But it's something that we do. We work a lot with a lot of people that we're very interested in is what we call the pre-doctoral students, which are the people who are doing the PhD projects. Not only do we actually look in there, if we think your idea is great, we will actually fund it too and provide you some funding for it, for you to be able to do that. But we also look at postdocs. So sometimes we look at people who are thinking about, hey, if they finish with this project, when they're doing their PhD, and the postdoc, they can work on this project and they can actually get this project going into a research. So we actually do that. So one of the things we had last year, we had 5 postdocs in our team. Right now, we are looking for a postdoc. So if you are someone who have finished PhD and want to spend time at our institute, we will pay for 1 year, and then you will have a specific thing to be able to do. If you have an idea from your doctoral time when you are doing your PhD that you want to continue, send it to us. We'll look at it. We also have areas that we want people to work on. So if you're someone who have finished their PhD, we have a postdoctoral program that we have. We have 5 of our people completed their postdoc this year. So we are beginning to build back on that. So we are looking first of all to 2 people. We just interviewed, we called for interview. So if you have an interest in those things, we will be able to do that. So to answer your specific questions, for pre-doc, your supervisor is your first concern. If you need additional help, please send us those kind of requests, and then we will be able to do that. Professor, I don't know if we have it in our site, but there's a place in our site website that you can actually request. If not, there is the email that Professor is giving. Send that up an email. We will see that things. We can't pick everything, so
Yes,
we pick
we
the things
have.
we are interested in.
Yes,
Okay.
we have a provision in our website to send us an email. If you have any questions, and just like Prof is saying, postdocs are needed, spread the word. You have the email, we put the email on the chat, right? Do us an email if you know anyone or you're interested. Thank you so much, Prof, for your time. And this, so many questions. I just had to pick a few of them because of want of time. I want to tell everyone, thank you for attending, and we're hoping to see you next month with another very interesting webinar topic. So keep your suggestions coming to us with our through our email. Tell us what you want to hear us talk about, and keep in touch. And remember, postdocs needed, spread the word, and have a fine week ahead. Thank you so much for attending, and bye-bye. Thank you so much, Prof.
Yeah, I will. I'm gonna stay a little while here, and I'm just reading some of the questions that we didn't get to. Since I have a few minutes, I have 4 minutes before my next meeting at 9:30. So I'm just looking the questions. I know we couldn't get to all of them. Some people are
Yeah.
saying, can we share a template with a logic model? Again, there are those things. If you need a consultation with that, please send us an email. We will have our expert in our team work with you on a selection of a logic model. Um, that's about framework for writing a good proposal to win a grant. We do those grant training. We have a portion of them that is paid, a portion of them that is not paid. We do a lot of them here that are not paid. Some of them that spend more time, we do have a paid version of that for a 12-month period. We work with you at the end point is that, but in that particular project, we only select you if you already have an idea. So we work with you to develop that idea, and the end point is submitting a grant. So this year we are taking 24 people, I think, to that program out of the 168 that applied. So it is competitive enough, but it is there. The time frame in terms of for the research question formulation, not really. But sometimes it is important if you're saying like over 24, that's why it's optional. If you wanted to say add that if it's important for that, but it's not really important. That's why it's called PICO, for people adding time by cut to be able to say, think about that. We didn't get to the for non-clinical trial research. Remember what a clinical trial means? A clinical trial means you have assigned a patient to a group. Once you have assigned patient to one or two groups, that's a clinical trial. So sometimes people don't recognize that there are questions like that. But if you're doing just a qualitative research that is there, we didn't get to that particular framework, but we listed it on the slide, and then you will see that from a lot of it. So we didn't get into into the independent and dependent variable. Those are more details of when you go down to data. We are just talking about a particular this time about the comparison of the intervention that you propose. When you now go, you can't throw much independent. And again, for our team, most of the time we don't spend time on didactic lectures. We don't do that. We actually spend more time on working on developing that. So when you do have that research question, and then we try to look at those comparison. How do you compare those outcome measures, and all of those things? That's where you develop those things. But you can't get there until you actually have a research question. That is your general question. The conceptual framework from our friend from Kano. We have a lot of that. We will actually have a lecture on that for those people who are selected into the city. We talked about the conceptual frameworks and different frameworks that drive different research. Again, it changes depending on the kind of grant that you are, the kind of proposal that you're developing. So we don't do the didactics, again, like we said, but when in the context of when we select someone that is working on a project, we will help you to decide how to select conceptual frameworks for your specific project. So once you've selected that the specific research question, we will help you with selection of conceptual framework. Some people who are talking about how do you know when a grant call is out, since some grants are more specific as for specific area. You need to be in your area of focus. You need to be able to check in. So for me, I check the NIH website every morning. So that's some of the things. So that's how I know. And that's my interest. And some people will check the Wellcome Trust every morning. And some people will check the Canadian one every morning. So people have expertise and the focus area. None of them is bad. I just focus on NIH grants because at my career stage, that's what I want to do. But if you're starting, go everywhere, search for grants in the for to look for 5,000 naira, 10,000 naira, whatever it is. Know that what you're trying to use it for is to develop your skills. Okay, I think that was some of the things we didn't answer in that general one that I saw here. But it was very interesting to stay with you. And thank you, everyone. And see you next time. Bye, Professor Nyaka.